I'm doing a room scan. I have my blank paper for taking notes on. Whoops. I'm gonna be right here. Okay. Hi, I'm Courtney. I'm gonna be a nursing assistant today. I will pull the curtain for privacy. I'm just gonna sanitize my hands quick. In most assessments, we would have to wear gloves and the proper PPE, but that is not required for today's assessment. So can I have you verify really quickly for me your name and date of birth?
Nikki McDaniel, 42192.
All right, just let me check that with your band. Sounds good. All right, so let me just verify with the doctor's orders. Today we're just doing a general assessment. So involved in the general assessment, I'm just going to be asking you some questions and getting your vitals. Does that sound okay?
Yeah.
All right. Do you have any allergies?
Nope.
All right, sounds good. Before we begin, do you have any concerns?
Nope.
All right, do you have to go to the bathroom or need glasses or hearing aids before we start?
Nope.
All right, sounds good. We'll jump right in. All right, so do you have any how's your appetite been? Is your appetite okay?
Mm-hmm.
All right, do you eat a well-balanced diet or you on any
Mostly.
special diet?
No special.
All right, what about your fluid intake? Do you drink roughly 8 cups of water a day?
Roughly.
All right, that's good. How about your mood?
Good.
Good, no awkward or no different behavioral changes lately?
No.
All right, that sounds good. Can you verify your name for me one more time, please?
Nikki McDaniel.
All right, and Nikki, do you know why you're here?
Class.
All right. Do you know roughly what time it is?
6:30.
All right, and do you know where you are?
Southwest Tech.
All right, sounds good. All right. So we're just gonna head over to the scale and I'll get your height and weight really quick.
Okay.
All right, thank you. You already got your shoes off for me. All right, we'll get your height first. All right, go ahead. All right, might bump down that a little. All right, go ahead. It's like we're at about 61.5 inches. And can I have you step on the scale for me? So touchy.
Mm-hmm.
All right, we're sitting at right about, just about 122. All right, 22.2 we'll go with. All right, and then if you want to come back over here. All right, do you quickly want to lift your arms up for me? All right, good range of motion. I noticed you were able to walk over to the scale pretty well. So then I'm just gonna get your temperature really quick.
Okay.
All right. All right, 98.7. So let me scribble this down quick. All right, and I noticed when you opened your mouth for the temperature that you had good mucous membranes, your skin's intact, no signs of edema. So I think we're good to just start in on your blood pressure. All right. I already had all my equipment in here before time. want to face your palm up for me, please? Alright, I'm just going to feel for your brachial artery. Alright. And it looks like it's about the right size for your arm. You roll up your sleeve a little bit. Put the arrow right about where your brachial, I found your arc or your pulse at. Alright. Make sure we're tightened all the way. Stop feeling your pulse about 110. Leave that on. And then I'm just gonna get your pulse really quick while we're waiting a couple minutes, okay? Alright. Alright, 61. Alright. Then I'm gonna get your respirations really quick too. Just breathe normally. I got 15. Now we're gonna finish up your blood pressure, okay? We're working good. Alright, 118 over 78. Alright, so, do you have any other questions about anything? Alright, normal, normal blood pressure is about 120/80, so you're sitting just below the normal range, but not too bad.
Okay.
Elevated blood pressure is about 120 to 129 over less than 80. Hypertension stage 1 is 130 to 139 over 80. Hypertension stage 2 is less than 120 over less than 80, and a hypertensive crisis is 180 to 189 over 120, or over more than 180. Sorry. Okay. Hypertensive crisis is more than 180 to 189 over more than 120. All right. So I'm just going to clean up all my equipment quick. All right. And then I'll get everything put away. Alright, do you have any more concerns while I'm here? I do have time. Alright, sounds good. So your call light, your call light is in place. Side rails are up and locked. Bed is low and locked. Your table's within reach. The room's clear of falls. So I think that's everything. Can you reach your table and your call light okay?
Mm-hmm.
Alright. I'm gonna wash my hands one more time. And the 5 moments of hand hygiene are before coming into contact with the patient, after contact with the patient, after contact with the patient's personal belongings, after contact with bodily fluids, and before a clean procedure.
Sounds good.
Alright, so if that's everything, then you have a good day, and I'll document everything in OneNote.
Sounds
Alright, thank you.